From the headquarters of Telesur English in Quito, Ecuador, I'm Carla Gonzalez, and this is From the South. Jamaica has recorded its first health worker to test positive to COVID-19. The Jamaican Health Minister, Christopher Tufton, made the announcement on Twitter. The victim is a 45-year-old health worker who was in contact with an infected patient. Jamaica has 36 confirmed cases of the COVID-19 to date. And Prime Minister Andrew Holness says that the persons who returned to Jamaica between March 18th and the 23rd who may not show symptoms and have not self-quarantined are the biggest threat to a spike in cases, and that the government will work to ensure that those individuals isolate themselves.
The biggest threat presently to our numbers spiking would be persons who returned to Jamaica within the last 14 days, specifically those who returned from the 18th of March to the 23rd of March, those who have not kept themselves in quarantine and who are circulating in the population who could possibly be asymptomatic or symptomatic and are spreading the disease in the population. So, having examined that threat, we have decided, which I had already put into the public domain, that we will be examining all the manifests that have come in, that is the manifests of aircraft, passenger aircrafts that have come in, which will provide us with the information of persons who have come into the island. We will continue to publicize all the flight numbers and dates of flights that have come into the island during that period of time. And we are asking citizens to pass on information to the relevant authorities using the various lines that have been provided by the Ministry of Health of persons who you may have information on, that they have come into the island, but they are not self-quarantining. We need to know. The manifests are with the police and the Ministry of Health, and they have been instructed to identify the persons on the manifest and to conduct checks based upon addresses and other leads to find persons who have come into the island and who are not quarantining. So we will be visiting addresses.
Jamaica's Ministry of Health and Wellness has implemented a system to help guide the work-from-home policy. Permanent Secretary Mr. Dustin Bryan explained.
Asked to stay at home as a function of quarantine, or you're asked to stay at home as a function of your requirement to self-isolate or self-quarantine. So the Ministry of Health and Wellness, in taking into regard this request for an HR transaction that allows organizations to verify persons who would have been required to stay at home, will be launching on Monday a system that allows persons who have been asked to stay at home to receive a special code that will also be emailed to their organization. Organizations will also be able to contact the ministry and verify whether or not persons have been asked to self-quarantine or being put in quarantine. The Ministry of Health and Wellness will also be instituting the same system for fit-to-work certification, where organizations will receive notification that an individual has completed their term of quarantine, and then they will be asked to, they will receive a document that allows the organization to verify that this person is now able to return to work. And these two mechanisms are critical, we believe, to the effective maintenance of the economic activities that we currently have in place.
A 34-member delegation of health specialists from Cuba arrived at the Robert L. Bradshaw International Airport in St. Kitts on Saturday to assist the government in strengthening its health sector in the fight against COVID-19. The delegation, which comprises 30 nurses and 4 doctors trained in intensive care medicine, was greeted at the airport by the country's health authorities and the Cuban ambassador. 28 of the specialists will be deployed in St. Kitts and 6 will be employed in Nevis. St. Kitts and Nevis to date has 7 confirmed cases of COVID-19 and no deaths. Prime Minister Dr. Timothy Harris announced a state of emergency for the entire country for 14 days, starting March 28th from 7 p.m. to 5 a.m. each day. St. Lucia now has a total of 9 confirmed cases of COVID-19. Among those diagnosed positive are St. Lucians who traveled to New York, Barbados, and Dominica. St. Lucia, like other countries, anticipates interruptions in regular shipment of testing supplies. Therefore, the public is asked to continue adhering to recommended measures for infection prevention and control. On Friday, St. Lucia received a contingent of 113 Cuban medical professionals to strengthen its national capacity to provide care during the COVID-19 response. These professionals are currently undergoing a 14-day quarantine period prior to commencement of their duties.
Oh, it's a great feeling, and today is a really wonderful day because, of course, we are receiving our Cuban brothers and sisters here, and of course, coming to St. Lucia, being the first in line to fight the COVID-19. So it is a great day to see them. And as president of the Association for the Friendship Association in St. Lucia, I am overwhelmed.
We are very excited. We are elated. You know, it took them a little while to get here because of transport issues, but now they are here. We are very comforted that we have the medical assistance that we need to fight this virus.
Your expectations?
Well, I expect that our system is going to be strengthened, and you know, things will go a lot more flawlessly now that we have additional support in our system.
It's a moment of pride, of a moment of solidarity between Cuba and St. Lucia. We are really very happy of the possibility to assist St. Lucia in this difficult moment. This has been our duty, and we will always do. Since the first moment we received the request from the St. Lucian government, and it was just 10 days ago, the Cuban government took it very quickly, that request, as a request of a sister country, and very quickly they started to work in the organization of this group. So we have already this group here full of doctors, nurses, biomedicals, engineers. All of them are from different parts of Cuba, different provinces, different specialties, different generations.
In Belize, the Ministry of Health has confirmed the 3rd case of COVID-19. The Director of Health Services provided a statement on this case.
The Ministry of Health is tonight confirming its 3rd case of COVID-19. 9 samples were screened today. One of those samples has turned out to be positive for COVID-19. That sample is from a male person who has a travel history to the US, who arrived in country on March 20th. The patient has been asymptomatic for the most part, but developed mild signs and symptoms on March 25th. The patient was swabbed on March 27th, and today the screening and confirmatory tests have confirmed that he is positive for COVID-19. That patient remains in self-isolation, and the Ministry of Health surveillance team has been activated and alerted to start conducting their mapping exercise. The male remains virtually asymptomatic, and once we have further details, we will be passing those as may be needed.
We have more stories coming up on the COVID-19 around the world, so don't go away. Welcome back. There are now more than 4,800 confirmed cases of coronavirus across the African continent. Most African countries have already put in place measures to prevent further spread of the virus. According to the Africa Center for Disease Control, about 146 people have died due to the COVID-19 out of 46 infected countries. 8 countries in the continent still remain uninfected. The Zimbabwean government has started to enforce a 3-week countrywide lockdown to fight against COVID-19. The government had declared a 21-day total shutdown, which included the suspension of flights in and outside Zimbabwe. The country has recorded 7 positive cases so far, with 1 patient reported dead.
It's a good call. Also, but what they should do is at least they should provide something. They should provide food to the people.
We don't know what to do, and we don't know when shall we get money. How shall we get money? Because our industry is down. It's locked down.
U.S. President Donald Trump is extending the voluntary national shutdown for a month as the coronavirus pandemic continues to claim victims in the country. The initial 15-day period of social distancing recommended by the government expires on Monday, and Trump had expressed interest in relaxing the guidelines in parts of the country less affected, but now he has decided to extend them through April 30th. Dr. Anthony Fauci, the government's top infectious disease expert, said the U.S. could see more than 100,000 deaths and millions of infections. The U.S. federal guidelines recommended against large gatherings and urged older people and anyone with existing health problems to stay at home. People are also urged to work at home where possible and avoid restaurants, bars, and non-essential travel, as well as shopping trips.
We will be extending our expect that by June 1st, we will be well on our way to recovery. We think by June 1st, a lot of great things will be happening. I want every citizen in our country to take heart and confidence in the fact that we have the best medical minds in the world tackling this disease. We have the best science, the best researchers, and the best talent anywhere working night and day to protect your family and loved ones and to overcome this pandemic.
Several Democratic governors in the United States stressed on Sunday that they feared hospitals in their states would soon be overwhelmed with COVID-19 patients. The Speaker of the House of Representatives, Nancy Pelosi, laid the blame for the nation's flawed response to the pandemic on President Trump, stressing that his denial of the seriousness of the pandemic was deadly. So far, the U.S. has reported more than 2,300 coronavirus-related deaths and over 130,000 confirmed cases. New York City Mayor Bill de Blasio said on Sunday that the city has a 1-week supply of medical supplies, as the number of cases in the city surpassed 33,000, representing more than half of the total in the state of New York. The mayor also expressed his concern over a shortage of medical personnel and noted he had made a direct request to President Trump to send more military and civilian doctors and nurses from around the country to support the efforts. The UK government has placed the country on an emergency footing as the battle against the spread of the novel coronavirus continues. Speaking at the government's daily briefing on Sunday, Community Secretary Robert Jenrick said it was an unprecedented step in peacetime.
This means that we're establishing strategic coordination centres across the whole country. Each centre is led by Gold Commanders. We're bringing together senior members of the emergency services, the police, the fire service, the ambulance service, with local authorities and the NHS to lead communities through this challenging period.
The number of new coronavirus cases reported daily in Germany is declining, suggesting that the rate of new infections may be slowing. Germany reported fewer than 4,000 new COVID-19 cases on Sunday, an apparent fall from the previous day. Meanwhile, figures released by the Robert Koch Institute revealed that the number of confirmed cases has surged past 50,000. The institute also reported 64 new deaths, bringing the total death toll to almost 400. Chancellor Angela Merkel has urged Germans to continue to cooperate with a nationwide lockdown aimed at halting the spread of the virus, stressing that the number of daily infections has to be radically reduced before the strict measures can be eased. And the German finance minister said on Sunday that EU countries were discussing mobilizing money from the Eurozone Rescue Fund to address the coronavirus pandemic.
Europäische Solidarität ist jetzt notwendig.
European solidarity is now necessary, and I hope that also goes regarding the individual measures that different countries are taking. It is really important that we achieve better coordination, but solidarity must also mean that we stick together financially. That is why we are working now and in this situation intimate that we, for example, besides measures of the European budget, besides new opportunities for the European Investment Bank, also ensure that countries can better carry this difficult task and the extra credit they have to take on.
Italy reported a slight decline in COVID-19 deaths on Sunday, although the overall death toll has surpassed 10,000. Italy now looks certain to extend its lockdown past the April 3rd deadline. Italian Prime Minister Giuseppe Conte told Italians late Saturday to be ready to spend more time at home. The country has been under a strict lockdown as the government struggles to contain the outbreak centered in the northern region. Doctors in Italy have issued dire warnings to other countries, including the United States, to prepare for the worst-case scenario. We're taking one last break, but stay with us. Thank you for joining us again. Brazilian President Jair Bolsonaro ignored the requests of the health ministry by walking around the capital on Sunday, approaching his supporters. He repeated his call to break the quarantine under the argument that Brazil cannot stop, because by doing so, it would end up like Venezuela. Bolsonaro described the novel coronavirus as a little flu and advocated the reopening of shops and schools, and that isolation measures be exclusively for people aged over 60. The virus has already killed more than 100 people in the country. With 215 million inhabitants, vast social inequality, and a lack of infrastructure, Brazil faces considerable challenges in containing the virus, which has so far demonstrated a case fatality rate of 2.8%. Venezuela confirmed 10 new cases of the novel coronavirus on Sunday, bringing the total to 129. Vice President for Communications Jorge Rodriguez confirmed the recovery of 39 patients in the country. Rodriguez stressed that quarantine is the mechanism to flatten the epidemic curve and reduce the number of infections. He also recalled that two neighboring countries, Colombia and Brazil, have seen an exponential growth in cases, which caused Venezuela to increase prevention measures. Rodriguez explained that there are almost 20,000 health workers deployed across the country, supervising those cases identified through an online survey. In Argentina, the government of President Alberto Fernandez has frozen rent payments and banned evictions from non-payment until September 30th. In addition, the validity of rental contracts will be extended with the approval of the parties. The Argentinian government has imposed a nationwide quarantine, which President Fernandez has now extended until April 12th. The country has reported almost 800 COVID-19 cases and 19 deaths. The number of cases in Argentina rose by the smallest margin in 5 days on Saturday, according to data released by the health ministry. Now to other news, 8 people were killed in the Philippines when a plane caught fire during takeoff from an airport on the outskirts of the capital, Manila, on Sunday evening. The plane, owned by Philippines registered charter service Lion Air, had been bound for the Japanese city of Haneda, but burst into flames at the end of the runway around 8 p.m. local time. According to local authorities, the plane was carrying 3 medical personnel, 3 flight crew, and a patient and his companion. An investigation has been launched to determine the cause of the accident.
That we confirmed that there was an accident that happened tonight at around 7:57 as per the information of their takeoff. And unfortunately, all the passengers, there were no survivors on the flight.
As the Nigerian government implements further health measures to try to curb the spread of the COVID-19 in the country, residents in Lagos are attempting to adapt as best as they can. The closure of markets, except for food and medicine, could eventually stifle the informal economy, which the majority of residents rely on. Nigeria has this far confirmed 40 COVID-19 cases.
So everybody will unlock the door because of the due to coronavirus that's around the world. So no markets, everybody lock up. We are inside the Idumota market in Lagos, in Nigeria now. So you can see all around the no people in the market. Everybody lock the store. So due to in order to prevent so that the coronavirus not they transfer to one another. That's the reason why. Thank you.
But it's actually training. It's like everywhere right now. People are forced to stay indoor. But yeah, people are complaining. Most countries, their government actually make provisions for them. You know, maybe probably some are not paying like 3 months house rent. Some the government are giving them money. A lot of, but yeah, none. It's really like that. And yeah, a lot of people can't actually do it themselves. A lot of people have to come to the market to sell before they can eat, before they can feed people. So that's the major problem here.
And with that, we end our news brief. But you can find these and many other stories by checking our website, telesurenglish.net. And be sure to also join us on social media. We're on Facebook, Twitter, and Instagram. For Telesur English, I'm Carla Gonzalez. Thank you for watching.